5, 4, 3, 2, 1. Good morning, everyone. This is Christian Brindle. This is the Everything Medicare Podcast. Today is August 21st. It's about 10 in the morning right now, and I was off last week due to my birthday. I know. I should have just sucked it up and brought you a podcast, even though it was my birthday, but I appreciate you guys giving me some slack and letting me take the day off. I spent the day with my lovely wife, and we had a lot of fun together. We went to an amusement park and just took the whole day off, which is very uncharacteristic for me, especially on a Monday. Today is Tuesday, and I'm bringing you a podcast a day late, so you have to forgive me. But I make sure that I bring it to you each and every week, and we try to do it Monday every week if possible. This week we're talking about Medicare, like we do every week. Not just Medicare, Medicaid, your Social Security, and everything that has to do with your retirement and the golden years of your life. And our topic today is, when can you change your Medicare plan? And that answer is dependent on what you have. The answer will be different if you have a Medigap than if you have a Medicare Advantage plan. So I'll take it one step at a time. Now, we all know there are exceptions to these rules, so let's get those out of the way first and foremost. The exceptions on when you can change your plans are life-changing events, what they call special election periods. Special election periods are times when you have unusual things happen to you. I'll give you an example. Let's say you move out of state. Well, you can change your plan then, because you're moving out of your plan's service area if you have a plan that has a service area, such as a prescription drug plan or a Medicare Advantage plan. You can change your plan any time of the year in that situation. That's just an example. And there's so many special election periods, and then I'm not going to bore you with going through all of them. But that's an example. Let's say you go into a nursing home. I'm not saying I wish that on anybody. I'm hoping that's not the case. But some people, it happens. I'm knocking on wood. I don't know if you can hear that. Let's say you're going into a nursing home. Well, that's a life-changing event. You can make changes then. Okay. Other than special election periods, the answer is very different based on what you have. So if you have a Medigap, you probably also have a PDP, short for prescription drug plan. So you have a Medigap that supplements Medicare, and you have a prescription drug plan to pay for prescriptions. So if, let's say you have a Medigap. Well, with Medigap, folks, it's pretty simple. There is no election period that has anything to do with Medigaps. Period, point blank. This is a common misconception. People that have Medigaps think that they have to wait till the enrollment period to change their plan. It's not true. You can change your Medigap year-round. 365 days a year, 12 months, every single year. Year-round, you can change your Medigap whenever you like. Here's how a Medigap works. They're very, very simple. When you first turn 65, or when you first get onto Medicare, whichever one happens first, you're able to get a Medigap with no health questions, no underwriting. It's a straight shot, no pre-existing conditions. But later, let's say you start on a Medigap with XYZ insurance company. It's not a real insurance company on purpose. I don't use the real names because I don't want to get myself in trouble. I have relationships with a lot of insurance companies, our company does, and I don't want to hurt anybody's feelings or step on anybody's toes, because that's not good for us. However, let's say, so hypothetically speaking, let's say you have a Medigap you picked up at age 65. You turn 65, you got a Medicare, you got a Medigap with XYZ insurance company. Let's say 2 years go by, you're 67 then, and you want to change it to Bobby's fantastic insurance company. Well, at that point, the new Medicare supplement company you're going to go with can then ask you health questions, put you through underwriting, and if you don't pass, they can potentially say no, or they can rate you up, whatever the case is. But let's assume you're healthy as a horse and you can pass these underwriting questions, these health questions. Assuming that's the case, you can change your Medigap year-round, as long as you can pass the health questions of the new company. Now, your prescription drug plan is a little different. Your prescription drug plan, you can only change during one time of the year, and that is what they call the annual election period. AEP for short. Now, AEP takes place October 15th through December 7th. That's the time period where you can change your prescription plan. Period. And not just change the prescription plan, that's the only time of the year you can change from a prescription plan to a Medicare Advantage plan if you choose to. Okay, so refresher. See how well you were paying attention. You can change your Medigap year-round as long as you can pass the health questions. The prescription drug plan can only be changed during the enrollment period. Now, you might think that's the answer for everything, the annual election period or AEP, but it's not. Stay with me into segment 2, and you'll find out there's other times you can change certain plans. Stay with me into segment 2. Welcome back, segment 2 of the Everything Medicare Podcast, where every single week I bring you a podcast specifically designed for everybody that wants to hear about Medicare, Medicaid, your Social Security, and everything that has to do with your retirement. You might think it's boring. Other people might think it's boring. Your children, your grandchildren, everybody might think it's boring, but I don't think it's boring. I stay up late thinking about this stuff, dreaming about this stuff. This is all I think about, folks. I'm a boring kind of guy. And I like boring stuff, but that's in your benefit. Because this is boring stuff you need to know about. I don't make it boring. I make it exciting. As exciting as it can be, I suppose. Okay, we're talking about when can you change your plan. And there's very different answers depending on what you have. In segment 1, I talked about Medigaps and prescription drug plans. But what about Medicare Advantage plans? The answer is not so simple. So, of course, during the annual enrollment period, you can switch from one Medicare Advantage plan to another, as well as switching from a prescription drug plan to a Medicare Advantage plan, or vice versa. It's a free-for-all during the annual election period, which, again, is October 15th through December 7th. We're getting close to the end of August. We're about a little over a month away from the annual election period. So I may or may not bring you a podcast during that time. Maybe not. We might have to move the day to Sunday. I don't know yet. Stay posted for future details on that. But that's our busy time of the year, folks. If I was a tax person, that'd be my tax season. Tax people got nothing on us. They have no idea how busy we are that time of year. Tax people got it easy compared to us during the annual election period. And I mean that. You can go ahead and tell your tax person I said that. Basically, annual election period. We're talking about a free-for-all where you can change prescription drug plan to Advantage plan to prescription drug plan to another Advantage plan, prescription drug plan to another prescription drug plan. But there's a new time period that's being added next year in 2019. Now, it's something that was around previously, years ago, and it went away. They call it OEP, which is short for Open Enrollment Period. I know they're so creative with their names. They should have me name all of their periods and they'd be more memorable. The only person that seems to remember them is me, but that's beside the point. OEP starts in January, goes through March. And in OEP, it's very specific. You can change your Advantage plan to another Advantage plan, and you can do it one time. That's it, folks. OEP. One Advantage plan to another Advantage plan. Doesn't work for prescription drug plans. Doesn't work from Advantage to PDP. Doesn't work from PDP to another PDP. Just one Medicare Advantage plan to another Medicare Advantage plan. So if you have an HMO, a PPO, a POS, any of these plans like that with networks and service areas, that's the time period where you can make your changes. This doesn't apply to federal plans. This doesn't apply to Obamacare. or marketplace plans. This doesn't apply to group plans. This is Medicare plans. So I don't want anyone getting a hold of me on social media or sending me an email telling me, well, my enrollment period starts in November. No, it doesn't. No, it doesn't. These are the Medicare enrollment periods, folks, for individual programs available to the public. So OEP is a new thing next year. Now, they did have, the last couple of years, have an enrollment period called the annual disenrollment period that went from January to, I think, the middle of February. And that's going away next year. Goodbye. And what the annual disenrollment period was is where you could go from a Medicare Advantage plan to a PDP. One time. And that's it. So they're just trading one very specific changing point to another. And, insurance companies aren't allowed to market. You shouldn't hear too much about it. You probably only hear about it from me. But it's a time where you can change your Advantage plan to another Advantage plan if for any reason it's not what you expected. That's kind of the idea behind it. Stay with me into segment 3 where we're going to wrap this conversation up, and I'm going to drop some other important pieces of information. Stay tuned. Welcome back, segment 3 of the Everything Medicare Podcast. So let's wrap this up, folks. In review, the time periods where you can change your plans are very, very simple. They're not that complex. If you have a Medicare Advantage plan, there's only one time of the year. Well, there's 2 times of the year you can change your plan, but there's certain time periods. You're basically locked in your plan for the whole year, unless you have some type of life-changing event happen to you. Same goes for PDPs. Medicaps, you can change them year-round. But basically, for the most part, folks, unless you're changing from one Medigap to another, most of the people that change their Medigap change from Medigap to an Advantage plan. More often than anything else, from my experience. So for the most part, even if you have a Medigap and you want to change to an Advantage plan, you can't do that year-round. You can only do that during the enrollment period because you can only get on or off an Advantage plan during the enrollment periods that we have. It's pretty simple. Just understand that before you get yourself locked into a plan, it's not good for you. If it doesn't make sense, think it over. It's very, very simple and not that complex. I mean, more people than not, from my experience, are on Advantage plans. That doesn't make them better or worse. I don't think Advantage plans are better or worse than Medigaps. It just depends on the person and where you live and the situation. I just think they both have their strengths and their weaknesses. They're just different, more than anything else. But you have enrollment periods, certain times of the year that you can make changes to your plan. Don't miss them. A lot of people do. And then they're stuck on the plan. They don't like the changes. If you're working with an agent, your agent should be contacting you, not by mail, not saying call me if you want to know the changes. Your agent, what we do in our office, for any single client we have that has a Medicare Advantage plan, we pick up the phone and call them the first week of October as soon as the changes are made public. And to tell them what's changing on their plan in next year. If they like it and they don't mind, good, we're good. If not, we do everything we can to make sure we're moving them to something that they like better. And sometimes that happens. Making sure that we are informing people, because the Advantage plans send out these big books, call them the annual notices of change every year, that no one has time to go through. No one can understand them, really. I mean, some people do, but for the most part, most people are just lost by these books, and that's all they have is guidance. I don't believe in that. I think that's garbage, and we're the only agency in the world that I've ever come across that does what we do. We'll pick up the phone, we'll call you, and we will make sure we're going through the changes with you and making sure you understand them. And it's because agents and agencies don't really care about you, folks. Very few do. They're lazy. They have an agenda. And they feel that if you want to know the changes, or if you want their help, you should pick up the phone and call them. Like they're paying you. And it's the other way around. So if you don't have an agent that's doing that, if you live in a place where we do business, which is Utah, Idaho, and Florida, those are the 3 places my company is licensed in, and that will be growing as time goes on. However, if you live in one of those 3 states, and you'd like to work with us, if you'd like to get the quality care, call us. Give our office a call for a no-obligation consultation, whether it be on the phone, whether it be in person. If you live in Utah, it can be in person. If you don't live in Utah, unless you're planning on coming to Utah, it'd have to be over the phone or virtually. We do either one. But call our office, 801-255-5340, and ask for me. Ask for Christian. I'm always happy to talk to you. If you don't live in our areas, make sure you find an agent who's going to take care of you. And I'd have to tell you, good luck. Because I read an article years ago, and I think there's so much truth to it, because I've seen it in my own life. 90+% of people that become insurance agents in the last 25 years are out of the business within a 5-year period. 90%. So that means 90% of the agents that you're talking to are new. They're just starting out. And you know how anything is when you're just starting out. You don't know anything about it. You don't know what you're talking about. You're not knowledgeable. I'm going to wrap this podcast up, folks. If you haven't picked up, if you don't live in our service area and you're not able to work with us, but you'd still like our guidance, go over to Amazon and look up Medicare Guidance, Picking the Plan for You by me, Christian Brindle. It's a $5 red, white, and blue book all about Medicare that I update every single year that I've published. It's $5 on Amazon. For that price, I'm practically giving it away. And it's 50 pages, an easy read. You can get through it in a day, if not a few hours. And it breaks down, in layman's terms, every option that you have available to you. If you didn't understand Medicare before, if you can get through that book cover to cover, you'll understand it better than 90+% of your peers. You have my guarantee, or I'll give you your money back. Follow us on your favorite social media for constant and consistent updates and material and whatever you're looking for. Health tips that we find and we pass along. Whatever you need. You can find it on your favorite social media if you follow us. Christian Brindle Insurance Services on Facebook, Christian Brindle Insurance on Instagram, Christian Brindle on YouTube for educational YouTube videos that I personally do myself, Christian Brindle on LinkedIn, and Christian Brindle without the E, because we couldn't fit it all, on Twitter, at Christian Brindle. Thank you, folks. Thank you for paying attention. Thank you for listening. And I can't wait to see you next week. Take care.